what are the best models for funding community social prescribing or pre-prescribing projects, and the provision not just for link workers in particular? So I wonder if you could speak to that, Nick, from your experience.
Yeah, sure. So social prescribing requires a varied range of social prescribing activities, such as green activities in a local area. And what we recommend is that you'll know that we've got the new integrated care systems coming in, which is all working together to improve outcomes for individuals and to address health inequalities. So what we recommend is that at a place level, so which is normally a local authority footprint, that health and local authorities work together with their voluntary sector partners, their nature partners and others to develop a strategy for social prescribing and social prescribing activities. And that would include what's the needs of the population, mapping what's currently in place, identifying the gaps, and really looking at sustainable commissioning and sustainable commissioning for the VCSE in particular, voluntary sector and social enterprise, faith community. And obviously we can use statutory funding, there's situations where we use statutory funding to meet those needs. But actually, funding social prescribing activities shouldn't be and will never be just the remit of health, because it involves nature, it involves employment, it involves housing, it involves lots and lots of different responsibilities. It requires everyone to work together. So it's about working together and looking at how you can bring your resources together that you've got and identifying where there's opportunities to draw down charitable funding or philanthropic funding as well. So where it works really, really well, local areas have that place-based strategy, and they are attracting others, setting it up in a way such as shared investment funding, where they can actually attract different sources of funding as well as statutory funding. So that's some of the things that we're seeing develop. And in the green social prescribing pilots or test and learn sites, that's the sort of thing that we're going to be looking at with them to see what you need to do to support green social prescribing to thrive.
That's really helpful, Nick. I suppose I'm just thinking about, there was another question on Slido, and people were saying, okay, so we've got all these different things happening in our area, how do we actually bring them together? And I just wondered, and this is a question to all the panel, so do raise your hand if you've got something to add on this. How do you bring those people together? I mean, is that something we're learning, or is that, do you have some knowledge about things that have worked? It sounded like having a strategy, you've just mentioned that is really important, and presumably that involves getting all the stakeholders together, but what else is really helpful in that scenario?
People connect it into the work of the health and wellbeing boards. There's also the opportunity to connect it into some of the NHS anchor organisation and
the anchor institution concept.
The anchor institution concept. But the test and learn sites have found different ways of engaging stakeholders to come together to have that conversation and get a shared plan together. So I don't know whether Jane wants to say some of the things. They've done some really interesting things, and I think social prescribing is often described as one of those things that's quite sticky. It attracts people. There's lots of reasons why people want to work together on it, but green social prescribing in particular seems to be something that can attract people together who want to make a change or a series of changes. So perhaps Jane or somebody,
you can give a bit more context on that one.
Yeah, thanks, Nick. Yeah, I mean, we've done lots of things in Surrey Heartlands to try and bring people, well, not to try, it wasn't difficult. People want to be part of this, which is fantastic. I already mentioned that we've got our green health and wellbeing network with well over 100 partners there, and that includes across sort of health local authority, but also grassroots partners as well, and link workers and all sorts of people involved with that. But one of the other things that we've done, which may be of interest, is we've employed the Commonplace map. Is it an app? I'm not sure. Anyway, we've employed that to allow people within our communities to pin on that map the different sorts of green activities that they're currently either running or involved with or are attending, so that we are beginning to build up, a picture of our Surrey footprint, about what we've already got that's going on. We know that there's so much going on in Surrey already, but then the second step for us then, now that we have this map, is to then go back to people and say, what works for you on this map. So if you have learning disability or autism, or if you care for somebody with dementia, or you have a mental health diagnosis, do any of these activities work for you? What are the barriers for you? You know, would you like to do some of these things, but you currently find that you can't access them for some reason? So rather than just building up a sort of straightforward directory, we're really thinking, okay, we've got all this fantastic stuff happening through the green pilot. We will be adding to it, but we've already got all this fantastic stuff happening. But we know from the work that we've done in the past and from our needs assessments and various other documents that we have, there are lots of people within our communities who are currently not accessing the benefits of green space. So how can we break down those barriers and make sure that as many people as possible are not only accessing green space, but that we're also thinking creatively about how we can bring green space into people's lives as well. So not just thinking about getting people outside, but also bringing green indoors for people who are you know, for whatever reason, are never going to be able to get outdoors and access things that way.
Great, thank you very much, Jane. So sort of a bit of a sense about what sort of happens at the individual levels, but also a sense about how you've brought people together through that network as well, to try and link all the different people up.